Hi there, and welcome to Wellness Wednesday. You know that every Wednesday we go live at 5 p.m. If you've been to our video channel before, thanks so much for coming back. Make sure if you haven't already, click that subscribe button and also hit that bell so it alerts you when we have new videos. We normally go live at 5 every Wellness Wednesday. We have a new video at 5 p.m., but every once in a while, I add new ones along the way. So make sure you tune in, and if you haven't already checked out some of our previous videos, make sure you go to our channel, click on videos, and you can find a ton more of all the ones we've been doing this year, educating you and trying to teach you how your body works, how it heals, and what we can do and what you can do at home to help make sure that you are supporting that healing process. So I'm really excited because this July we are focusing on family care. That means that with the chiropractic care, it's really interesting because with chiropractic care, you can benefit throughout your lifetime from chiropractic. So when women are pregnant, a lot of times they may have some issues with not only back pain and things like that, but also headaches and a lot of other issues. But then, of course, after baby is born, birth process can be pretty rough on mom and baby. We also provide chiropractic care for newborns, as well as toddlers and children and young adults and teenagers. And we are able to provide care throughout your lifetime and throughout every stage of your life so that your body is working at 100% and healing at 100% because your body can heal itself. So it's really interesting to see how that all works. But today we are focused a little bit more about chiropractic and pregnancy. So today we are going to be talking a little bit more about how chiropractic not only can help with pregnancy, but also with cesarean sections and trying to avoid those a little bit more. So I'm going to go ahead and share my screen because I do have quite a few visuals today. I feel like especially when it comes to anatomy of the body, especially when it comes to anatomy of pregnancy, there's a lot of changes that happen. So I want to make sure I provide some visuals to really help educate you on that. So let me go ahead and share my screen here. And then I'm going to go ahead and get started with this. All right, so we'll let this load up, but apparently I did not start at the beginning. So how can chiropractic help my pregnancy? So if you don't know me or my office, my name is Dr. Andrea Shanowski. I am a chiropractor and holistic healthcare provider and wellness provider here in Peoria, Illinois. Our office is Freedom Chiropractic and Holistic Health. Our phone number is 309-689-6200, or you can also check out more information on our website, freedompeoria.org. You can also request an appointment on our website too. But like I said, today we're going to talk a little bit more about how chiropractic can help pregnancy. So let's start with the agenda. So tonight's agenda, we're going to start with talking about the current cesarean or C-section delivery rates and some of the concerns with those rates and our percentages right now in the United States. We're going to talk a little bit more about what chiropractic is and how that can help with pregnancy and beyond. We're going to talk a little bit more about the pelvis and pregnancy anatomy, because I think as you see how that pelvis and how pregnancy changes your body, it may help you understand a little bit more about why you may be experiencing some of the symptoms that you might be currently. We'll talk a little bit more about what body changes happen with pregnancy, as well as some common pregnancy conditions that we have seen in our office and we've also been able to help with in our office. And then, of course, we're going to talk a little bit more about how chiropractic can help your pregnancy specifically. So we're going to start with the World Health Organization. So in 1985, the World Health Organization said there's no justification for any region to have cesarean section rates higher than 10 to 15%. And this was actually a study published in The Lancet in 1985 talking about appropriate technology for birth. Now, what's really interesting is the director of Women and Children's Health for the World Health Organization previously said that when you have C-section rates go above 15%, the maternal mortality rates or rises. But what that really means is that C-sections can actually increase death rates for mothers. It can now be reliably calculated that C-section is the #1 cause of maternal mortality in the United States, and at least 45% of all maternal death is associated with C-section. And those were from studies done in 2007 and 2008. If we look at our current rate in the United States, so our current rate of cesarean section is 32%. That means that our rate is currently double what was recommended back in 1985. And we know that by having higher levels of cesarean delivery, that can increase risk factors not only for mother, but also for baby. And a lot of times that can also affect how baby develops afterwards. So we're going to talk a little bit more about what we can do as we kind of look at the cesarean rate, as well as what you can do to prevent cesarean for yourself if you want to move towards more of a natural birth. So if we look at the rates back in 91, we were at about a 23%, and over the years, have increased that rate. As you see, as we go up to the rate of 2007, that rate is at 32%. So one of the things that I always find is a lot of times when women are coming to my office during pregnancy, they are wanting to prevent C-section if at all possible. Obviously, C-section is absolutely 100% necessary in emergency medical situations. If mom or baby is not doing well and they need to go in and intervene, by all means, they know exactly what to do and how to do that. But we also want to try to set ourselves up for a successful natural birth as much as possible. It's much easier for mom to recover. It's much easier for baby to recover. And in many cases, it's safer for both mom and baby with development as well as bonding and things like that. Because when C-section does happen, there are quite a bit of medications that mom is given. There are also some increased risk factors for baby too. So number one, you've got to be informed. So you have to know what it is that you should be doing to, number one, try to prevent that C-section, but also what you can do at home, as well as talking to your provider about what you can do to potentially have more of a natural birth. We also want to be preventative. That means that we need to be doing some pelvic stretching and positioning to make sure that our pelvis and our body is ready for the birth process. In some cases, chiropractic care can be absolutely essential for that. Not only to make sure that you are not dealing with pain, but also to make sure that those joints are moving properly and that the actual hole, the pelvic canal, is nice and open and aligned so it's easier for baby to be born. Another thing is being prepared. So number one, you want to make sure you have a birth plan. You want to have support in the delivery process. So whether you're doing a home birth, whether you're doing a birth at a birth center, whether you're doing a hospital birth, whatever way you choose to go with that, you want to make sure you have a good support system and a good partner to help through that. We also want to make sure that you know different breathing techniques. So every once in a while, if you've been to a birth class, you may have learned maybe one or two breathing techniques, but there are so many out there. There's everything from hypnobirthing to spinning babies, to Lama's class, to as well as a number of other breathing techniques. I have found myself that sometimes having multiple breathing techniques in different ways you've been practicing ahead of time can be really helpful, because in the moment, one way may not work the best for you or may not make sense at that time period. We also want to make sure that we want to know natural pain relieving methods. So a lot of times you may not realize this, but chiropractic care during pregnancy and even delivery can actually provide pain relief for mom by increasing some of those natural pain relievers. The other thing too is there are stretching techniques. There are specific positionings as well as pressure and massage that can be applied for mom during the delivery process that can help relieve pain and potentially avoid medication or potentially avoid any interventions being used. So you do have the right to a natural birth, so it's completely up to you to make sure as much as you can, be informed, be preventative, and be prepared before the birth process itself, and making sure you have all the tools in your toolbox to make sure that you have a natural birth. If you do have an emergency situation where you need to get a C-section, obviously you want to make sure that you communicate with your doctor, and they are going to do everything possible to make sure you and baby are safe. So we're going to talk a little bit more about chiropractic. So chiropractic is very misunderstood. I think a lot of people, when they think of chiropractic, only think about back and neck pain. But the reality is you have bones throughout your whole entire spine, and those bones actually protect your nervous system. Those are designed to basically encase and protect that nervous system because it controls the function of everything. So when we look at the spine, we have bones stacked on top of one another. We've got that cartilage disc right here in between the bones, and then there's a hole behind that, which is where your nerves go through. So if we have a bone that's not moving properly or out of position, like that third one down, you can see that shifted backwards, and that's going to put pressure on that nerve, which can cause symptoms, but it's also not going to move properly, which can also irritate the joints. It can irritate the ligaments, the cartilage, and even cause muscle spasms too. Now, when it comes to those bone misalignments, chiropractors in many cases call those subluxations or misalignments. In some cases, when that bone shifts out of place or subluxates, it's a chiropractic subluxation, we can actually see that the joints don't move properly, but we don't always have immediate pain with it. Sometimes we'll get muscle stiffness or spasms. Sometimes it just feels tighter. We don't always have pain with that. Now, what's really important, I already mentioned this already, is that your nervous system is completely encased and protected by bone because it is so important. Now, the weight of a dime or a coin on those paper-thin nerves coming out of the spine can reduce your nerve flow by about 60%. So it doesn't take much pressure to have an issue when those bones move out of place. Another thing to keep in mind that those nerves in your spine control every single cell, organ, and muscle in your body. So that's going to affect not only things like eyesight, but we can see also digestive issues. We can see even problems with hormone imbalance, and even immune function are affected if there's pressure on the nervous system. So reality check today is talking about the spine, the fact that your spine protects the most vital system in your body, which is that nervous system that controls every single function and every aspect of your health. So you need to maintain and protect your spine if you want to be healthy, because that is the number one thing that makes everything work and function how it's supposed to. So if there's nerve pressure and it's not functioning properly, that's going to affect every single aspect of your health and also every single aspect of baby's health too. So we're going to talk a little bit more about anatomy, because I think this is really important to realize how everything fits together and how it changes throughout the pregnancy. So if we start with looking at the pelvis, so we have the sacrum, which is kind of that arrow-shaped bone. That is actually the very last bone in your spine. And that makes contact on both sides with the iliums, which are what I like to call the Mickey Mouse ears. And those ears come down and join in the front in your pubic bone. So that structure makes a ring shape. And if we look, when baby is born, baby has to fit through that ring shape to get out of the pelvic canal. So it's very important to make sure that those bones are aligned. And I'm going to show some other pictures which really help to illustrate that a little bit more thoroughly. I think a lot of times when we think about the pelvis, yes, that pubic bone does enlarge. Yes, those SI joints do stretch, but we want to make sure that that hole for the pelvic, for the actual canal and the birth canal is nice and open. So if we look at a view kind of looking through, so this is a bottom view looking from, you can see those red lines cross from side to side for the pelvis, but then also contacts with the coccyx to the front of that pubic bone. If all those are in alignment, you can see there is a nice big circle, nice big space for baby to pass through. However, if we have any shifting of the sacrum, if we have any shifting of the pelvis, that can make that space, rather than being round and nice and large and open, it can actually be a more oval shape, and baby's going to be more likely to actually get stuck within the pelvic canal. So very important to see that if there is anything out of alignment, twisted, torqued in any way, shape, or form, not exactly going to be a lot of room for baby to come through. As you can see, there's not much clearance either way around there. And we already know birth is difficult enough without clearance issues. If we look from kind of a view inside of that pelvis, so we have all these white ligaments, and these are the ligaments that actually hold those bones together. Now, with pregnancy hormones, those ligaments will actually loosen, and they're able to stretch a bit more so that we have space for that pelvic cavity to open as baby goes through. Now, what's really neat is when we look at those pelvic ligaments, if you have any rotation, ligaments can be irritated, and that means that they're not going to stretch as much on one side, and that again can affect that hole and the birth canal where baby comes through. Another thing to think of is if we look at the actual pelvic muscle, so the very top is the front of your pelvis and the very back is your spine. So we have basically, as we're looking at that pelvic anatomy, all of these muscles in our pelvic floor that help to make sure that, number one, we have a nice suspension hammock holding all of our organ systems in and supporting baby. But if we do have any rotation of the pelvic bones, that can also affect where the muscles are not working evenly. If muscles on one side are tighter, it's going to be hard for them to assist with pushing baby out. And we're going to use a lot of our, not only pelvic floor muscles, but also some of our muscles in our core as well. What's really interesting to me is when we look at the ligaments that actually sustain baby. So this picture here shows a very large uterus. This is going to be near the very end of pregnancy, right before delivery. You can see that we have this ligament here on the very front of the uterus. So on your left is going to be the front of the uterus, on your back, on your right is going to be the back, and you can see the spine in this picture. But we have this round ligament here in the very front that attaches from the front of your pelvis up to the uterus. If we have the pelvic bone shifted or rotated, that can actually twist the uterus, which means there's going to be less room for baby inside of the uterus, which means that that can cause some difficulty for baby to shift and move during the pregnancy, but that can also cause some abdominal pain for mom too. So if you are currently pregnant and having any abdominal pains more kind of below your belly button or on the very front of your pelvic cavity, that may be due to that ligament stretching or maybe even being tight on one side. If we look at the back, we have one large ligament that attaches from the back of the uterus straight to the sacrum, and you can see that attaches back here. If we have any rotation or twisting of that sacrum where it's not moving properly, that can cause that uterus to shift forward. And a lot of times we will have more pain in the very front of our pelvic cavity near our pubic bone. We also have this really big kind of rubber band shaped ligament that goes all the way around, and it actually attaches. You can see kind of a cutout view here. This attaches all the way around and attaches across your whole entire lower back. So that literally is kind of like a big stretchy band that holds that uterus back and close to the spine. Now, if we have any twisting or issues with the spine not moving, that can actually cause the uterus to twist backwards pressing on the colon, which means that can cause some issues with being able to use the restroom properly throughout your pregnancy. So for women, typically there are some changes, which we'll talk about soon, more about pregnancy and digestion, how things move through, but also if that uterus is positioned improperly due to muscle or joint alignment issues, that can also cause some problems for you too. Another thing to think of is as baby grows, we are going to see that uterus grow along with it. So very important to realize that as baby grows and that uterus changes, that is going to change positioning of the uterus within the pelvic cavity. If we look at body changes, so your body will change over time, especially throughout that pregnancy. So we will actually see about 14% increased energy requirements. So if you're getting very tired, that's because your body is trying to make more energy to grow baby, and there may not be much left over for you. We also are going to see that our sweat and our perspiration and our respiration actually increases too. So we'll have about 40% more respiration, so more energy and air requirements, but we will also see sometimes increased waste products coming through our skin as a result of that, because when you breathe more, you have more waste products that are produced. So in some cases, we can also see where our body has more waste products it's trying to get rid of because it is going to be working a little harder. We also will have 2 times the blood volume with 250% more blood going to your uterus. That means that you are going to have a lot more blood coursing through your body, a lot more oxygen going to the uterus and going to baby as well. We will have about 1.5 times more white blood cells than normal, which means your immune system is going to boost up so that you can help make sure that not only do you have a strong immune system, but you're protecting baby as well. We'll also see an increased metabolism. So a lot of times we will see where mom is eating more food and craving more foods. But what's really interesting is your digestion slows down. So even though that you are eating more food, your body is going to actually increase the digestive enzymes in your stomach, break it down faster. It's going to slow down as it goes through digestion. So that way your body can absorb more of the nutrition from the food that you're eating. So even though you have an increased metabolism, you're eating more, the rest of your digestion slows down. Now, one question I get a lot, well, does posture change with pregnancy? And here's the thing, this is a trick question, not really, but kind of. So obviously, as belly develops, you're going to have more weight that your body is handling and more weight that your spine is handling. But what's really interesting is, even though your belly increases, the only change happens to your center of gravity. So your center of gravity shifts forward because you're going to have more weight. So normally your center of gravity is around your belly button, but as baby grows, it's going to move forward. Typically, that means that your spinal curvature should not change. However, your stance and your pelvis is going to widen a little bit. So a lot of times throughout the pregnancy, you may stand with your legs a little bit further apart, help support that extra body weight and also that gravity shift that has changed. But typically, your actual curvature in your spine does not change, just the weight is going to put more pressure on the joints. And some common pregnancy conditions that we see in our office and we've been able to help with are things like back pain, obviously with that extra pressure on the joints and the fact that those ligaments loosen up, the muscles have to work harder. If the joints are not moving properly, that can actually cause joint pain. But I mentioned already abdominal pain. So I mentioned if we have any movement of the joints in the pelvis or the lower back, that can shift the uterus weight, which can put pressure on the ligaments and cause abdominal pain. We can also see headaches result. Number one, I already mentioned that you've got that blood flow increase, so you have more oxygen coursing through. But in many cases with the hormone changes, we can actually see where some of the blood vessels will actually tighten. So we don't get as much oxygen, as much blood flow to our head. And in some cases that can cause headaches. With the hormone changes by themselves, that can also cause headaches. So in many cases in our office, we're able to provide chiropractic care to help make sure that blood flow and nerve flow to the brain are working properly. And a lot of times massage can also be really helpful to make sure that you're getting proper blood flow to your brain to help prevent and reverse those headaches if they do start occurring. Another thing we see a lot and very commonly is heartburn or acid reflux. So with pregnancy, obviously, like I mentioned already, your digestion enzymes being produced in your stomach increase, so you have more stomach acid being produced. So if you're not eating more frequently, if you're not eating meals that have a good balance to help make sure that you have something in your stomach, that extra acid can actually cause irritation of the stomach and even cause issues with heartburn. Then of course, as you get later on in pregnancy and baby is growing and taking up more room, they can put direct pressure on the stomach that can also contribute to heartburn or acid reflux. Another thing that I see a lot in my office is breech presentation. So typically, as baby gets bigger in the womb, they do have to shift so that they're head down, so it's easier for delivery. However, what I have found is in some cases, if the pelvis or the lower back and the actual joints themselves are not moving properly, and the uterus twists, there's less room inside that uterus for baby to turn upside down with head down. Typically, depending on what type of provider you're seeing, some providers will check that with ultrasound, some will do that manually, but they want to make sure that baby is head down. Now, typically, baby can flip head down anywhere between 32 up to delivery time. Typically, if you have been told you have a breech presentation and you've been under chiropractic care, or you've already been doing some stretching and some pelvic positioning, and baby is still not flipping head down, that could indicate you may have an issue either with the uterus or the ligaments or the spine, or potentially even a shorter cord for baby that can make it difficult for them to flip face down. So in many cases, what I typically do in my office is I check to see that the joints are moving properly. I check to make sure that we can do some massage and stretching for the uterine ligaments to help make sure that it's easier and there's more room for a baby to flip head down. Typically, if you're 38 weeks and baby hasn't flipped, that's when we really want to start being a little bit more aggressive with making sure we're doing some of those stretches and making sure you're doing everything possible to keep everything loose so the baby is able to flip head down if they need to do that. Another thing we can see a lot of times with pregnancy is if we do have some issues with how that pelvis is moving or the uterus is not positioned properly, what can happen is after labor starts, it may be hard for baby to drop down into the pelvis. It may be hard for a baby to get through the pelvis if that pelvis is rotated and we see that birth canal being shifted in more of an oval shape rather than a nice circle. So chiropractic care can help your pregnancy, and here's how. 84% of pregnant mothers reported that they have back pain relief with chiropractic adjustments. We can also see some of that abdominal pain I mentioned earlier can also be due to uterine ligament tension. So by doing chiropractic care, and specifically a technique called Webster's that I offer here in my office, that can help to reduce some of that tension on the ligaments and help make sure there's more room for baby, as well as less pain for mom in those abdominal ligaments. We also see less likelihood of back labor or back pain during delivery for mom. And we also see better birth outcomes with VBAC, which is vaginal birth after cesarean. So if you've already had a cesarean section and you are trying for a vaginal birth the second time around, typically we will see that chiropractic care can help make sure you have a little bit better birth outcomes when it comes to going back to a vaginal birth after cesarean section. Another thing that chiropractic can help with is headaches. And I mentioned this already. A 2001 Duke University study found there was almost immediate improvement for headaches in pregnant women. We also saw longer lasting improvement compared with medication, fewer side effects, and because again, we find the actual cause of your headache and try to reduce or get rid of that cause so the headaches don't keep coming back. When it comes to heartburn, I already mentioned that those nerves in the spine control every single cell, muscle, and organ in your body. There was a study done looking at a 30-year-old woman who was 24 weeks pregnant. She was having persistent heartburn and heartburn was actually being treated with not only Tums, but also an over-the-counter medication or prescription medication, basically to help reduce those symptoms and relieve her symptoms. The symptoms weren't really doing much, but after 5 chiropractic treatments, her heartburn went away and she was able to discontinue that medication and not need it the rest of her pregnancy. So pretty amazing. If we can help reduce medication needs, we can help make sure that we're doing less risk for a baby. Chiropractic, like I mentioned, can help with breech, and it's not necessarily that Webster technique is for breech, but typically baby, like I said, should be turning pretty much anytime after 32 weeks. Typically 36 to 38 is when we want to make sure that baby flips head down. But like I mentioned, if we have any issues with the sacrum or that pelvis being positioned improperly, that can pull on the muscles and the ligaments, and that can affect that baby is not able to turn. So like I mentioned, Webster technique is a specialized chiropractic technique. Only chiropractors are trained in that. It does relieve intrauterine constraints. So not specifically for breech, it basically helps remove pressure on the uterus so there's more room in the pelvic canal and it's easier and there's less tension so that it's easier for baby to flip. What's interesting is there was actually a study done on Webster's technique and they found that it's got a 92% success rate in breech positioning. So for women that are coming in for chiropractic care, specifically for this Webster's technique to help see if that will relieve some constraints so baby can flip, it's got a 92% success rate. Of the ones that did not flip, there was some reported incidents where they had shorter cords or the cord was wrapped around the baby's neck in the actual uterus themselves. So, like I mentioned already, we've got those ligaments that hold that uterus together. This is a picture of a basically a normal size uterus, but as you can see, those ligaments actually hold everything together. So if we're able to relieve tension on the ligaments, relieve tension on the bones and the pelvic canal, that can help a lot to make sure there's plenty of room for baby to move and flip around. Chiropractic can also help with labor. There's a record of 24% shorter labor times in first pregnancies and 39% shorter labor time in subsequent pregnancies after that first one. Like I mentioned already, a properly aligned pelvis is going to allow more room for baby to turn and more room for baby to descend into the birth canal as well. The other thing that's really interesting is chiropractic care can stimulate non-progressive labors due to pelvic outlet disproportion. So again, if that pelvis is rotated and that hole is more oval shape rather than circle, when we do chiropractic adjusting, that can actually help to open up the pelvis, and that can be really helpful. So if you or your birth attendant is planning on doing, if you're doing either a birth center labor or a home birth or even a hospital birth, you may talk to your provider to see if they would be open to having a chiropractor adjust you if you do get it to a point of the birth where you're not progressing very well. And that can be very helpful. So one of the big questions I get is chiropractic safe? Well, when it comes to it, there are no contraindications to chiropractic care throughout your pregnancy. Whether you are early in your pregnancy or late in your pregnancy, there are different styles of chiropractic techniques that can be safe throughout. I have had patients that were put on bed rest. I've actually gone to their homes to provide some soft tissue adjusting and massage to help get them some relief, but also make sure that their pelvis was moving properly. Obviously, you do need to talk to your provider. So whether you have an OB or whether you have a midwife or elsewhere, just make sure you talk to them to make sure that they are okay with you seeking out chiropractic care and that they understand the benefits of them. And if they don't, have them give my office a call. I would be more than happy to go into their office and provide them with some education and research that's shown that chiropractic is safe for pregnant women throughout their pregnancy as well. So one thing that's really important is you want to make sure you don't just wish for a great birth, but prepare for one. So like I mentioned, you want to make sure you have a birth plan. If you need some help with that, I do have some templates to help you write a birth plan so that you know a little bit more about what you're getting into and what you want to be prepared for during the birth as well as afterwards too. So my gift to you, those of you that are still tuned in right now and watching this video, I want to make sure that you understand in our office, we are more about education and we want to sit down with you one-on-one to explain and talk to you more about what's going on for your health and if chiropractic in our office would be a good benefit to your provider window. So we have basically a free pregnancy consultation that is to prepare for your ideal birth with a properly aligned pelvis and a uterus with optimum positioning for baby and for the birth process. So that is valid until the end of July. So please make sure you go on our website. That's freedompeoria.org, or you can give our office a call, 309-689-6200, and we can get you set up for that consultation free of charge. After baby's born, we also want to offer a free newborn chiropractic examination. So typically in our office, we do very gentle examinations for baby. Typically you're holding on to baby and we're just feeling to make sure that the bones are moving properly. We're making sure that they are having a great experience with sleep, a great experience being held, as well as a great experience with nursing or feeding. We want to make sure that they are not having any digestive issues. And if they are, we want to make sure we talk to you a little bit more about what you can do to improve that, to make sure that they have the best experience as a newborn on this earth. So one thing that's really important to realize is as baby is being born, there's about 95 pounds of pressure on the top of their head coming through the birth canal. And because they don't have muscle supporting their neck yet, a lot of times the bones in their spine can actually shift out of position during birth. And that can lead to colic, that can lead to sleeping issues, that can lead to digestive issues. It can lead to issues where they are not swallowing or feeding properly or nursing properly. And that can cause not only issues for them, but also issues for mom too, especially if you're trying to breastfeed and having difficulty with that. About 95% of infants do have misalignments after birth. It's not always a huge joint misalignment. Sometimes we just need a little bit of massage to help loosen up some muscles that may be tight or unbalanced after the birth process. We have quite a few videos on our YouTube channel, specifically on chiropractic care. We'll be bringing more to our channel this month, more specifically about chiropractic care in kids. So we'll have some demonstrations on how we would do an evaluation for a child as well as a pre or almost teenager. And we'll talk a little bit more about newborns as well. So every newborn should receive a neck and spine examination and a chiropractic adjustment if necessary. Is that idea too difficult to accept? That was actually from Landon Smith, who is a pediatrician and a medical doctor who recommended that chiropractors do check babies after birth, because we want to make sure that their body has everything it needs to have a very great experience after the birth process. So if you don't know more about my office, I mentioned already, Freedom Chiropractic and Holistic Health. We're located in Peoria, Illinois in the Metro Center, and our phone number is 309-689-6200, or you can go to our website, freedompeoria.org, for more information. Well, I wanted to thank you so much for, again, joining me today, and hopefully you learned a ton more about not only chiropractic, but also about pregnancy and what you can be doing to prevent health issues, and what you can do to prevent pain relief or pain during your pregnancy, and what you can do to help make sure that you have the most comfortable pregnancy possible, the most comfortable delivery possible, and the best way for a baby to start their life. So thanks for tuning in. Make sure you join us next week. We're going to talk a little bit more about fertility and hormone balance. So for those of you that are not pregnant but are wanting to become pregnant or are starting to try, this would be a great video for you to watch next week at 5 o'clock, so that you know what we can do to help, or at least understand how those hormones work together. So thanks again, and have a great rest of your day. I appreciate you guys stopping in, and make sure you tune in next week. Wellness Wednesday, we go live at 5. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell, so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5.